Middle ear. Welcome to our anatomy series. Today we'll explore the middle ear, its structure, key components, and role in hearing. Let's begin. The middle ear is known as the tympanic cavity. Is a narrow slit-like in the temporal bone. The middle ear is situated between the external and internal ear. It contains 3 auditory ossicles. Vertical diameter of middle ear is 15 millimeters, and anterior posterior diameter of the middle ear is 15 millimeters. The middle ear communicates with nasopharynx through the pharyngotympanic tube. Subdivisions of the middle ear. The tympanic cavity is divided into 3 parts. Epitympanum, attic, a part above the tympanic membrane containing head of Malleus, body, and short process of Incus. Mesotympanum, a part opposite to tympanic membrane containing handle of Malleus, long process of Incus, and Stapes. It is the narrowest part of the middle ear. Hypotympanum, a part below the tympanic membrane. Boundaries of middle ear. The roof is formed by a thin plate of bone called tegmen tympani. The floor is also formed by a thin plate of bone, which is separate the tympanic cavity from the jugular bulb. The anterior wall is formed by a thin plate of the bone. In the lower part, it separates the cavity from the internal carotid artery. The posterior wall separates the tympanic cavity from the mastoid antrum. Posterior wall presenting the following features: Aditis ad antrum, fossa incudes, pyramid, vertical part of facial canal, posterior canaliculus for chorda tympani. The medial wall separates the tympanic cavity from the internal ear. The medial wall presents the following features: promontory, oval window, fenestra, vestibuli, round window, fenestra cochleae, sinus tympani, the prominence of oblique part of the facial canal, the prominence of lateral semicircular canal of the internal ear. The lateral wall is formed by a tympanic membrane, which separates the tympanic cavity from the external auditory meatus. Ear ossicles. The 3 ear ossicles, Malleus, Incus, and Stapes, within the middle ear, are connected by synovial joints and form a bony chain that extends across the tympanic cavity from the tympanic membrane to the oval window. Malleus, it resembles a hammer and therefore known as Malleus. It has a head, neck, handle, manubrium, a lateral process, and an anterior process. Incus. It consists of a relatively large body and 2 slender processes, a short process and a long process. The body and short process lie in the attic, whereas its long process hangs vertically behind and parallel with the handle of the Malleus. Its bulbous tip, lentiform nodule, is directed medially to articulate with the head of the stapes, forming the incutostapedial joint, ball and socket type of synovial joint. Stapes. It resembles a stirrup. It consists of head, neck, anterior and posterior crura, and footplate. The footplate closes the oval window and is attached to its margin by the annular ligament. There are two intratympanic muscles: Tensor tympani muscle and Stapedius muscle. Pharyngotympanic tube. The pharyngotympanic tube, auditory tube, is an osseo-cartilaginous tube which connects the nasopharynx with the tympanic cavity, middle ear. It is directed downwards, forwards, and medially from the tympanic cavity to the nasopharynx. The auditory tube maintains the equilibrium of air pressure on either side of the tympanic membrane for its proper vibration. Arterial supply. Anterior tympanic branch of the maxillary artery. Stylomastoid branch of the posterior auricular artery. Petrosal branch of the middle meningeal artery. Superior tympanic branch of the middle meningeal artery, running along the canal for tensor tympani. A branch from the artery of the pterygoid canal. Tympanic branch of the internal carotid artery. Venous drainage. The veins from middle ear drain into pterygoid venous plexus via squamotympanic fissure. Lymphatic drainage. The lymphatics from middle ear drain into parotid lymph nodes, upper deep cervical lymph nodes, nerve supply, tympanic branch of Glossopharyngeal Nerve. It enters the middle ear through a canaliculus in the floor of the tympanic cavity and takes part in the formation of tympanic plexus. It provides sensory supply to the lining of middle ear, antrum, and auditory tube. That was a brief overview of the middle ear. Subscribe for more clear and concise medical explanations.